it's it's amazing when you keep on hearing the same thing over and over and over again. We have the capacity, we have the people, we have the factories, but we just don't seem to be joining the dots. And this is not anything new. So, from your perspective, what should we be doing? What can we do? Who is supposed, and what mechanisms can we use to bring these people together to join the dots?
Thank you very much, Marani. And I think Dr. Sioi and Dr. Kakitu talked about it. And one of the things they talked about was the multi-stakeholder engagement in moving the needle, as it were. And I'm happy that we had the COVID pandemic. One of the things that the COVID pandemic really brought out for the health sector, and something that we've always advocated for, is that one, we need a whole of systems approach, looking at the entire health sector as not as a single entity. So for example, now we are looking at the pharma industry, but it requires a lot of other inputs, which we've all spoken to at length this morning: human resources for health, healthcare facilities where this vaccine is going to be given through, community healthcare workers, and then what are the other auxiliary services that need to bring this to bear. So if you looked at the COVID vaccine manufacturing committee setup, it's not just the health sector. Yeah, it brought together other players. And I'm sure somebody wondered, why is Ministry of Defense there? Why is Ministry of Interior, Internal Affairs Interior there? Because we are talking about vaccine manufacturing. We are talking about something for the entirety of the population of Kenya. It's a biosafety, biosecurity issue. We're going to partner with not only local manufacturers, but with other manufacturers. So how do we secure this? And the reason you're seeing this move now of Ministry of Health working with other stakeholders is, even at central government, what happens, since 2019, the president put in place something called the executive order. If you all recall what we call the super ministry, Ministry of Interior and Coordination of National Government. So what this means is that every week, bi-weekly, there is a meeting of the PSs, meeting of the CSs of all the state departments. So for example, when we're talking about vaccine manufacturing in Kenya, it's not just about Ministry of Health alone. And that's why it's been very difficult to move the needle in a lot of projects in Kenya where we have white elephants. So you find in this instance, we need to work with the Ministry of Energy. We know that power is a huge impediment. We need to work with the Ministry of Trade and Industrialization, where all the pharma manufacturing companies actually fall. And that has been one of the biggest, I'd say, bottlenecks, because you have the pharma industry working in kind of, I won't call it being regulated, but really that they fall under Ministry of Trade and Industrialization. But then you have Ministry of Health that deals with human health, and the two of them are not talking. So if we're talking about going into human vaccine manufacturing, Ministry of Health cannot lead this by itself. Yes, it's a technical lead that brings, but you need all these other. You need Ministry of Transport. You need Ministry of Trade and Industry because of the special economic zones. Where, I mean, if we're talking about Konza Technopolis, you know, it's not under Ministry of ICT alone. So what else? Who else needs to be in this to ensure that all the key stakeholders bring our dreams to bear? So, so what I was trying to, you're asking the ultimate convener. So what the ultimate convener started doing since 2019 is that there's a lot of accountability. These forums are called the National Development, you can look for them on Google, National Development Implementation Technical Committee, where all the PSs sit, and these get reports directly from the sub-county level, and this is also scaled up to the cabinet level. And so you asked, what does that want to say? Yeah, so you asked, what is the government doing? The government is ensuring that there's a coordinated effort towards bringing initiatives such as this to bear and bringing all the key stakeholders on board. And Ministry of Trade and Industrialization, KEPSA falls under that. Kenya Healthcare Federation is part of the health sector board. So when issues health sector are being discussed, is KHF making sure that the health sector issues are well understood by Ministry of Trade and Industry as they come to present their issues there. And is KHF making sure that Ministry of Health and Ministry of Trade and Industry are speaking and are addressing the issues that private sector is concerned about. So again, we also have to start thinking beyond our own silo as a health sector if we really want to move things ahead. Government is doing that. Government is facilitating that. The mechanisms are there. And yeah, we're here to guide you.
Eunice, maybe from a policy perspective where you sit, the coordination, the financing, the intergovernmental, interagency, what is it that is happening, and what is it that private sector we need to be aware, or where can we plug in from HPT perspective?
So as mentioned before, there are a lot of, we need to do this in a collaborative way, beyond MOH, beyond state agencies, because each of them have a role to ensure that we have the required products. So in addition to what Dr. Njeri said, there's that need to, I think, put more effort. The discussions have started in certain aspects, but we need to build on that, even as we look at the issue of vaccine and other products being locally manufactured. Because the challenge with the silo mentality is that everyone is moving, but you're not moving in the same direction. There are things that we need other agencies or institutions to do to make it easier for us to move faster. So we need to ensure that that is coordinated from government level. Of course, even as we bring in partners and other stakeholders, we should already have a plan, a roadmap as government. So they plug in and we move in that direction. So our role as, let me say, as national government, regardless of what ministries, to guide, give strategic direction and coordinate whichever partners we need to engage in. Thank you.